Good evening. And as we have heard again and again, and we will keep hearing, the problems brought on by COVID-19 were not new. They simply highlighted and stressed the existing disparities and problems that, in fact, I have observed for at least 10 years, but are much longer. So the disparities were only magnified. We will address the issue of employment. And in this case, under COVID, there were those workers that were privileged. They were able to go home. They had highly trained jobs, professional jobs in a lot of cases, were able to work from home, maintain their income, maintain their health insurance, particularly important during the health crisis, and also were able to deal with all the school closures and the closures of daycares. And they were able to maintain their lives. And this was a really privileged position. COVID was not great for anyone, but being able to stay at home and work was truly privileged. Then there were those workers deemed essential, those workers who worked at grocery stores, warehouses, as drivers, workers in hospitals, doing the cleaning, people who were essential to the well-being to the rest of us, who were able to stay at home and who needed services. These workers were not able to isolate, provide distance, social distance, and in many cases were not able to even afford the protective equipment that they needed to protect themselves, masks, gloves, hand sanitizer, that sort of thing. These workers were only considered essential in the sense that they were essential for our survival, but they were not considered essential in terms of their own protection, their ability to receive the supports that they needed. And certainly they were not essential in terms of their wages. They were really expendable workers when it came to their own lives. And then there were the truly unfortunate workers who lost their jobs. Those workers in restaurants and the hospitality industry and the entertainment industry. And a lot of these workers did not have the savings to be able to face a situation in which they lost their income, sometimes from one day to the next. And so what was at risk was their housing, their health, obviously their health insurance, even their ability to feed themselves. This was the situation for workers. And Greg will provide some of the statistics.
It doesn't take long looking at the numbers to see how racially divided the effect of COVID has been on employment in Memphis. And you start from the fact that roughly 21% of Blacks and 26% of Hispanics in Memphis work in service jobs, while only 13% of whites do. Roughly 23% of whites and Blacks work in office jobs, while only 13% of Hispanics do. Roughly 5% of whites and 6% of Blacks work in agricultural jobs, while 30% of Hispanics do. On the other hand, roughly 50% of whites work in managerial or professional jobs, the jobs most likely to be work from home ready, while only 25% of Blacks and 15% of Hispanics do. So you are all set up at that point for once COVID hits, it's going to hit the people who can't work from home. And sure enough, the most acute job losses were restaurant, janitorial, secretarial, and agricultural jobs. Jobs where they disproportionately employed Blacks and Hispanics, whereas jobs which mainly employed whites were not affected anywhere near as badly. Then we look at this quote recovery, and I put square quotes around recovery because not everybody is recovering. In Shelby County, you had 20 at the beginning, job losses of 23% of low-income workers, 11 to 12% of middle-income workers, and 9% of high-income workers in April of 2020 versus January of 2020. Those are big drops, but you can see the job drops disproportionately affect low-income jobs. By the end of June, things had stabilized a little bit, but still, you have almost 10% down for low-income workers, almost 8% down for middle-income workers, whereas high-income workers were all back to work. Now, you go forward to May of 2021, and high-income workers are 12% more employed than they were before COVID, whereas middle-income workers are still down 6%, and low-income workers are still down 10%. And because the low and middle-income workers are the ones who are disproportionately Black and Hispanic in Memphis, this leads to a vast disparity in who is seeing a recovery.
Not only that, then we have the policies that have created this unfair system, this abuse of normative policies, and the policies instituted by the state of Tennessee, for instance, that ended unemployment benefits early. The additional support and unemployment benefits that had helped some people survive the worst of the pandemic were ended. People are often called lazy and they are offered no supports. In addition, small businesses received less help, and it was more difficult for them to get a couple $1,000s than big businesses. So we have a system that already privileges capital at the expense of Main Street workers and small businesses. It just got worse. Even when there was help, there was less help for the worker and the small business, and it ended early. It was removed very, very early. You have to keep in mind that small businesses are the backbone of America. Workers in small businesses are. Small businesses bring 2/3 of all the job growth, 40% of the gross domestic product in this country, and yet they are the most vulnerable. Small businesses, the majority had only about 2 weeks of money to face this situation and tremendous difficulty accessing the CARES money. So what do we do about it? There are a number of policy recommendations that we would like to make. And the first one is workers need a living wage. The minimum wage that we have right now doesn't approximate a living wage by any definition. But when people are in poverty, it is very difficult for them to have any savings at all that will allow them to face something like this. We also need to understand that jobless benefits are incredibly important, particularly when we have a situation such as COVID that forced the closures of so many businesses and places of employment. We need to make sure that people have some protection for when something terrible happens and through no fault of their own, they lose their job. We need universal health care. People need to be able to know that they will have access to healthcare even when they are not able to work. And we need universal childcare. It's been mentioned before. Parents cannot go to work if they're not supported in terms of childcare. Essential workers found this firsthand, and they really had a hard time when they were not able to find childcare. And as been mentioned before, the internet and access to digital technologies is an essential need for the community. We need to categorize it as a utility, just like electricity or water, because this is as important today as having electricity or water in your house. Children were particularly impacted hard, as we have heard. We also need to have policies that support small businesses. We need to make sure that small businesses have access to capital at low interest rates. The same terms that big businesses have and mega corporations, we need to make sure are available to the small businesses that are the backbone of America. We also need to make sure that our education system is producing the workers that small businesses need and provide the training that those small business owners need. And finally, although this is probably not enough, but I will mention universal healthcare. Universal healthcare will allow small businesses to compete with large businesses and protect their workers without having to spend money that they simply do not have. If we had universal healthcare, small businesses would be on par with large businesses in ability to provide benefits. These are some of the things we need to do. These are the policies we need to have a fair economy for everyone.
Thank you.